This is Dr. Shannon Wong in Austin, Texas. I'm going to describe my technique for combined cataract surgery and Descemet stripping endothelial keratoplasty, or DSEK. This patient has Fuchs dystrophy, and we do topical clear corneal cataract surgery. We call this basic cataract surgery. We use standard face gold emulsification techniques. We use a bent needle cystotome to create a circular capsulorhexis. Here we're using the Alcon Centurion phacoemulsification device to remove the cataract in a routine fashion. We use an epsilon chopper to assist us in this technique. After the cataract is removed, we polish the capsule using a silicone-tipped irrigation and aspiration instrument made by MST Microsurgical. I use an 8.5 millimeter corneal tree fine that has been marked with gentian violet to delineate the area of the DSEK. We then use a Singer sweeper, again made by Epsilon Instruments, to polish the posterior surface of the anterior capsule and remove any lens epithelial cells. Then I take a reverse Sinskey instrument and I score the area that was delineated by my mark. This essentially creates the zone of endothelium of the cornea that will be removed. We then use a corneal hoe to peel away the corneal endothelium that is abnormal in this patient with Fuchs dystrophy. We then take the reverse Sinskey hook and score the posterior stromal fibers at the periphery of the donor site. A 10-0 nylon suture is pre-placed We vacuum any residual material from the endothelium using our irrigation and aspiration instrument. A posterior chamber lens is then inserted, and again we vacuum the posterior stroma to remove any residual viscoelastic material. Then additional paracentesis sites are created, which will help us in positioning our donor graft. Then the 2.8 millimeter incision is widened to approximately 5 millimeters to allow placement of the DSEK donor cornea. A sheets glide is introduced into the anterior chamber. This sheets glide will serve as a runway which will allow us to insert our donor cornea. The donor cornea has been prepared. It has an 8.5 millimeter diameter. We apply viscoelastic to the endothelium to protect it. We place the donor cornea on a spatula. The endothelium is now, or the donor cornea is now placed onto the sheets glide. Viscoelastic has been placed on the sheets glide to protect the endothelium. We use a 30 gauge TB needle on a syringe to insert the donor cornea. There is no anterior chamber maintainer used. We then remove the sheets glide. The tenonylon is then tied and an air bubble is introduced between the lens implant and the donor cornea. We can modify the position of the donor using our reverse Sinskey hook to gently maneuver the donor into optimal centration. Air is used to pressurize the globe and to ensure that the donor is adherent to the patient's cornea. Air bubble is left in place for 5 to 10 minutes, and then the patient is sent to recovery room. The suture is buried. Thank you for your time and attention.